Welcome everyone. Today we're doing a question and answer session on IPL Photofacial treatments. So the IPL Photofacial treatment is a great treatment that uses bright light to target pigment, blood, redness in the skin. It's great for age spots, sunspots, redness, broken capillaries. It can improve enlarged pores. So people love it. When we do it here in the office, we take baseline photographs, apply numbing cream, let that sit for about 15 minutes, then bring you back, clean you off with some water and cleansing solutions, and we'll put some eye protection over your eyes. You will see the bright light. Just keep your eyes closed. You'll be fine. We put cold gel and cold air on your skin to keep you comfortable and to transmit the light. And when we do the treatment, it feels like a hot rubber band snapping. The treatment itself takes about 5 minutes. People tolerate it just fine. Afterwards, we take off your eye protection, clean off your skin, allow you to hold the cold air for a few minutes, and give you some sunscreen, and you're good to go. There are a couple of other treatments that we do in combination with the IPL. One is the micro laser peel, which removes a thin layer of dead skin cells from the surface, enhancing the results of the IPL Photofacial. And the second is called the laser skin tightening, which heats up the skin, stimulates collagen formation. It's really good for redness, rosacea, enlarged pores, and fine lines. Those treatments just take a few extra minutes, no real additional downtime. When we add the micro laser peel, we call that the soft and smooth rejuvenation. And when we combine the IPL Photofacial with the laser skin tightening, we call that the tight and bright rejuvenation treatment. We do have a number of before and after pictures and testimonials on our website, and you can take a look at that. We also have them on our Facebook. Welcome to everyone who's joining us. We're talking about the IPL Photofacial treatment, and we are answering questions. If you have questions, ask them and we'll answer them. Right now I'm on Real Self and answering questions that people ask. One is, when is it safe to do an IPL laser to decrease the redness of a surgical scar? After surgery, you can get a scar and you can have redness. I recommend waiting for the scar to heal for 2 weeks to 4 weeks. Then you can do an IPL photofacial on the redness. How soon do you get results? So that's a good question. Normally I recommend an initial series of 3 to 6 treatments. You can do them once a month. After that, we do maintenance treatment once every 3 to 4 months. You have to be patient. You're not going to see the results right away. It could take some time. So do a series of 3 to 6 treatments. Does the IPL help with collagen production? It can help a little bit with collagen production. Really, when you add the second step, which I previously discussed, the laser skin tightening, that really boosts the effects of the collagen enhancement because it heats up the skin, it heats up the deeper layers of the skin, stimulating collagen formation, and that will help with fine lines. It also helps with redness, and it helps with enlarged pores. Does it help to fade freckles away? So that's a perfect reason to do an IPL photofacial treatment. If you have any dark discolorations that you want to get rid of, whether it's a dark spot, sunspot, freckle, age spot, any of those things, it will help with that. Sometimes it does take a few treatments. If the pigment is deeper in the skin, you may need a deeper treatment like a fractional laser. I'm glad we're getting lots of questions. And let's see, what else do we have here? Is IPL good for Asian skin? So there are 6 different skin types that we call the Fitzpatrick skin types. That's numbered from 1 through 6 in Roman numerals. 1 is the fairest and 6 is the darkest. And when you have darker skin, you have to be more careful and adjust the settings on the IPL. But it can be done on Asian skin. Most Asians are in the class 4 Fitzpatrick skin type, and we just adjust the filters and the settings to address Asian skin. You have to stop using products before IPLs. Not really from just the IPL or a skin tightening, but if you are doing an ablative treatment, a chemical peel, a laser peel, or a fractional laser, I recommend stopping skincare products including retinol, salicylic acid, glycolic acid, and the like about 1 week before, and you can resume them safely about 1 week after that. So let's see what other questions do we have here. Okay, we already answered that. One question is redness after an IPL. Yes, it is normal to be red and or swollen for a day or two after the IPL. This is normal. You can apply cold compresses like ice packs to keep yourself comfortable if necessary. Sometimes after the treatment, the dark spots do get darker before they get lighter. That's normal. That can take a couple of weeks. Prolonged discoloration beyond that can be treated with creams. Make sure you are using sunscreen every day. When you do combine treatments, these treatments with products like a skincare regimen, you get even better effects. A lot of the patients that do these treatments love the brightening cream. That will help lighten up the dark spots. It also is good for acne and for anti-aging. It stimulates collagen. Other products that can be used include exfoliants like salicylic acid and antioxidants like vitamin C or vitamin E, like our triple antioxidant serum. Let's see. IPL. Can you use it for hair removal? Yes, so lasers and various light sources can be used for hair removal. We use specific settings. Basically, the laser targets the pigment in the hair and it destroys it. For laser hair removal, you do need a series, usually 6 to 8 treatments, sometimes more, up to 10 to 12 treatments, especially if your skin is darker. You have to use lower settings and you have to do more treatments. It does lead to permanent hair reduction. Typically, you'll do one maintenance treatment every year or two thereafter. But people that do laser hair removal are really happy with it for the most part. Underarms is a very common area, for example, and what people say after doing a series of those treatments is that they hardly ever have to shave. It's so easy and it makes everything really easy. Okay, IPL for rosacea. Rosacea is a common condition characterized by the appearance of redness, especially in the central face, like in the nose and the cheeks, but it can spread to the entire face or even down the neck and chest. Common triggers include heat, alcohol, spicy foods, sun exposure, emotional stress, and so forth. Important things for that are to avoid these triggers, use sunscreen every day, use products like antioxidants, and look for ingredients such as niacinamide or vitamin B3 that helps with redness. And the IPL Photofacial really can help with rosacea. It helps with the redness. It can help with broken capillaries. Usually you need an initial series of 3 to 6 treatments. Do them once a month. After that, we do one maintenance treatment every 3 months or so. Patients that do it who have rosacea are really happy with the results. It can be very difficult to treat rosacea with oral medications or topical medications. So let's take a look at this. Poikiloderma. Poikiloderma or poikiloderma of Civat is something you can see on the neck. It gets red in color and it has an irregular bumpy texture, almost like an alligator or something like that. And the IPL Photofacial laser works really well on that. You do need a series, again, as with anything. And you can see some before and after pictures. We have one really good one on the neck on our website, so go take a look at that. Is IPL good for melasma? Melasma is another common condition characterized by the appearance of dark patches on the skin. Common areas include the forehead, the cheeks, the upper lip. This occurs in response to sunlight, usually. So if you normally get a lot of sunlight and then you get a tan, this will occur with just a small amount of sunlight. It will give you essentially what is a tan or a hyperpigmentation. Melasma is caused by an imbalance of hormones in the skin. So although there are ways to address it by applying topical products and doing various laser treatments, it will come back. Therefore, I tell patients that melasma is a condition that we control, not cure, so maintenance treatments will be required. IPL can work on melasma, especially if the pigment is in the surface layers. You really want to combine this with a good skincare regimen like the brightening cream, and exfoliant, and antioxidant, hydrating serum, and definitely sunscreen. You can combine some of the other treatments like a micro laser peel, and you can also do fractional lasers and apply topical hydroquinone. We do have before and after pictures on our website. Check those out. We'll do some more questions and answers later next time. Thank you everyone for joining us, and we will save this on our Facebook Live and it will go up to YouTube. Please contact us if you have any questions. Thank you.